Hello once again. Welcome to my Aquablation story part 3. If you listen to the first and second part, I had my procedure on May the 19th. That was a Thursday, and it was done at 8:30 in the morning. After spending one night in the hospital, I came home about 8 o'clock on Friday morning. And then on Saturday morning, I told you that I started to develop a couple of complications again. So Saturday morning, I was resting in my bed, lying on my back, propped up, reading a book. Again, it was about 10 in the morning when I noticed that there was a lot of pressure on my bladder. It was feeling like it was filling up quite quickly and not emptying. So I pulled back the covers. I looked at the catheter. There was no urine flow at all coming out of the catheter. Not the joints, but not even any urine flow coming out of the catheter whatsoever. And I had been told to drink a lot of water, so the urine was backing up in my bladder and causing me a lot of discomfort. I was getting a little bit nervous why there was no urine flow at all coming out of the bladder. I moved over to my side, tried my left side, tried my right side. Still no urine flow. I stood up, I sat up, still no urine flow at all. So now I was kind of reaching a crisis mode because the urine in my bladder was backing up and causing me a lot of discomfort. Still no flow at all through the bladder. So I called my wife and she said, maybe you need to call 911. I didn't really want to do that and have an ambulance ride to the hospital. I've never called 911 before, and I didn't really want to do that. So she suggested that we go to the emergency room. But by the time I got dressed and we got in the car, found our way to the hospital, found the emergency room, checked in and went through the process, it was likely to be a couple hours before anybody would even see me. And I didn't have that much time. The pressure in my bladder was building up a lot. I was afraid it was backing up into my kidneys. And I knew that I had reached crisis mode and I had to take matters into my own hand. So I made a decision to grab a pair of scissors and ran into the bathroom, stood over the toilet. I cut the valve on the catheter that would deflate the balloon. I waited about 10 or 20 seconds for the balloon to deflate inside my bladder, which was holding the catheter in place. And I went ahead and I pulled the catheter out. After I did that, a little bit of urine and a bunch of blood started dripping out into the toilet. And then all of a sudden there was a lot of pressure and a bunch of tissue started coming out. Just globs of tissue started to come out and fall into the toilet. Once that tissue fell out, I was able to pass a little bit of urine. I stood over the toilet for about 5 minutes, let some of the urine and blood drip out, and that started to relieve some of the pressure on my bladder. I asked my wife to grab my camera. I took a couple of pictures of the amount of tissue that passed through me into the toilet so that when I went to see the doctor, I could show him what had happened to me. At that moment, I didn't exactly know what to do after that. So I went and I pulled out that folder of my pre-op paperwork. I looked through all of the information in the folder, including Dr. Kriteman's letter, but there was no support numbers to call at all in case complications develop, none whatsoever. So I really didn't know if I should go to the ER and let them irrigate me and put a new catheter in. So I tried dialing the Georgia Urology main number. Again, it was a Saturday morning. Of course, I had to listen to a long-winded message, and finally it got to the point where if you wanted to leave a message or talk to one of the on-call physicians, push 2. As soon as I pushed 2, the line went dead. I tried it a couple more times, line would go dead. My wife and I tried it together on 2 different phones about 10 times or so, and sometimes the message would start, but then within a few seconds the line would just go dead. So again, there was no support from Georgia Urology at all. And so my wife thought it would be a good idea to go to the ER and maybe have a new catheter put in because I was supposed to leave it in until Monday morning when Mr. Manley was going to give me a call. But I wanted to wait a little while, so as time passed by that morning, by late morning, I was actually passing a little bit of urine better. I wouldn't say that it was much of a stream, but it was a very thin stream along with some blood that was coming out. And I just continued to drink a lot of water. By 2 in the afternoon, the stream had gotten a little bit better. It was kind of an obstructed stream that kind of went in a couple of different directions, but at least the urine was passing through. So I decided, maybe I don't need to go to the ER, and I would wait and see how I did Saturday night and into Sunday morning. By Sunday, the urine stream was getting a little bit better. There was a little bit of burning sensation, especially when the stream started, and when the stream ended is when most of the burning occurred. And the blood was a lot redder at the beginning of the stream, and then at the end of the stream it would drip blood a little bit as well. So I went ahead and I thought, well, I'll just make it through Sunday and look forward to Clint Manley's call on Monday. Remember, he told me he was going to call me on Monday and talk about the color of my urine in the catheter bag, and maybe allow me to go ahead and remove the catheter. So I waited for his call on Monday. The call did not come in on Monday morning, and the call did not come in on Monday afternoon. I was a little bit disappointed that Clint didn't give me a call like he told me he was going to do. That doesn't negate the fact that the first two times I met with Clint Manley, I mean, he couldn't have been more wonderful. And he took very good care of me the two times I was in the office. So I just put it down to, he meant well when he told me that on Friday, and probably he just got busy, didn't put it on his schedule or on his calendar, and so he didn't give me a call. But by Monday evening, the stream was getting better and better. Tuesday and Wednesday, the stream was still improving. There was still blood in the urine. I was a little bit nervous about that, but the stream was getting better. And a couple of good things was, one, the stream would start right away, and number two, it seemed to be emptying out my bladder pretty well. So that was an improvement, though, because before the aquablation, my stream was very, very weak, and I could never empty out my bladder completely, and I'd have to go very frequently. And so I decided to wait, because on June the 1st, I had an appointment with Dr. Kriteman for my follow-up visit, my post-op visit. So I thought I could wait to the following Wednesday at least. So, but then Friday morning, because I was still bleeding, and now I was about 10, 11 days out from the procedure, I went to the Georgia Urology portal, and I sent a message to Dr. Kriteman, or Dr. Kriteman's clinical nurse. And I just said, here I am 10 days out. It's Friday morning. We're going into a long 3-day Memorial weekend. And I'm still seeing a lot of bleeding into the toilet after I urinate. And I was just wondering if this is okay, if I should go ahead and wait, or if I should come in and do something Friday before the long weekend. This was early on Friday morning when I sent the message to the portal. And I guess, Georgia Urology, what do you expect? There was no return message, and no one answered that message at all. So I went into the long Memorial Day weekend doing okay. A lot of blood in the urine still, a little bit of burning and dripping, especially at the end of the stream. But I would go ahead and wait till Wednesday to my appointment to see Dr. Kriteman. I will say this, though. I told you that I passed a bunch of tissue when I first pulled the catheter out, took a picture of that. But the next day on Sunday, the same thing happened. It was about Sunday evening, about 7 o'clock in the evening, and again, there was a lot of pressure on my bladder, and a bunch more tissue pushed through into the toilet. And again, I took a picture of that for Dr. Kriteman that I could show him when I saw him on my follow-up appointment on Wednesday. So finally, Wednesday, my appointment, I think, was scheduled for about 8:40 in the morning. The first thing, a nurse took me back, and she did an ultrasound on my lower abdomen. She said she just wanted to see if my bladder was emptying completely, because before that she had asked me to give a urine sample and try to empty my bladder. The ultrasound showed that my bladder was emptying pretty well, and she told me that Dr. Kriteman would be in to see me in just a little while. So I waited in the exam room for Dr. Kriteman to come in. When he came in this time, I told him, listen, I know you're very, very busy, but I'm going to need to take a few minutes to explain to you exactly what happened and some of the complications that occurred. And so I went on to tell him about the blockage I had in the joints of the catheter at the hospital and how they had tried to flush it through. And then I told him about the incident on Saturday morning when my catheter was completely blocked, not allowing any urine flow, and I had to make that crisis decision to go ahead and pull the catheter out, and what followed. He listened to me. He really didn't have anything to say, I said, let me just show you a picture of all the tissue that came out of me that Saturday morning. He barely looked at the picture. He just shrugged his shoulders, and there was no empathy. He didn't commiserate with it. He didn't say, I'm sorry, or this is the reason why this happened. He just kind of sloughed it off and really didn't say anything much about it. I tried to show him the second picture, but there was no point. He wasn't even interested really in looking at the first picture. He just said that everything looks good. The bleeding is normal. I said, well, I'm a little bit nervous about the bleeding because now I'm almost 2 weeks out from the procedure. He said, that's okay. You'll probably bleed for another week or two, but eventually the bleeding will stop. I said, so there's no danger of losing too much blood or becoming anemic? He said, no, don't worry about it. You're going to probably continue to bleed for a while, but you're not going to become anemic. He just patted me on the shoulder, and off he went. And so he told me that, before he left, he said, I'd like to see you back in 3 months just to do a follow-up. So, again, I was a little bit taken aback by Dr. Kriteman. I made my appointment for 3 months out, and I left the office and went on home. And so now I'm going to give you my opinion of Dr. Louis Kriteman. And remember, this is only my opinion based on my experiences with Dr. Kriteman. So if you listen to part 1 of my video, I told you that I first saw Dr. Kriteman back in 2018 and that he was very hurried. He just came into my room, asked me what my problem was, gave me a questionnaire, left for about 10 or 15 minutes, came back in, looked at the questionnaire, shook his head and just said, I'm going to give you a prescription for a medication to take, and maybe that will alleviate some of your symptoms. And I was really taken aback that he didn't sit down and talk to me at all or explain to me what was going on. He was just in a hurry and out the door he went. So I told you I did research and didn't take the medicine right away. And after another year or so having to live with the symptoms of BPH, I went back to the Georgia Urology practice, but this time I saw another doctor. He was very friendly. He sat down, he talked to me about BPH, about some of my issues and some of the treatments, about the different medications that I had a choice of taking. And also he wanted to go ahead and do that cystoscopy. So he was a very nice, very friendly doctor, but at that time, he had little to no experience with the Aquablation procedure. And after doing all that research, the reason why I chose Dr. Kriteman was because, according to all the research, he was one of the most experienced physicians in this area, if not the United States, doing the Aquablation procedure. So I went back to see him. Remember, he was hurried. He talked to me about Aquablation. Again, I went to see him 9 months later. He talked to me about Aquablation very quickly. And I decided, you know what, it was time to go ahead and do the procedure. So the reason why I chose Dr. Kriteman again is because he was so experienced. And after listening to his webinar and things like that, I figured he would be the best physician to see to do this procedure. But in my opinion, and this is just my opinion, and I'm a little bit skeptical, I admit, but based on the way I was treated with Dr. Kriteman, I think Dr. Kriteman is the stereotypical physician who really has no bedside manner whatsoever, is unable or unwilling to empathize or talk to his patients one-on-one, and probably treats his patients according to their station in life. And I think that when he did my procedure, and again, this is only conjecture, I think by then he was so experienced and had done so many of those procedures, and he had so many lined up just that day alone, that he's become very complacent with doing the procedure. And I think he was just probably going through the motions. And I'm wondering whether he spent an adequate amount of time, especially following the procedure. Did he irrigate me really well? Did he get out all that fluffy tissue and all that tissue that was excised from the water jet after the Aquablation procedure? Did he take the time to go in and cauterize all the bleeders like you're supposed to do? Did he go back in and have a look to make sure that did he take the time to go back in and have a look to make sure that all the tissue, all the dead tissue was out of my bladder? Did he take the time to make sure that he had cauterized all the bleeders and there was no bleeding going on? I'm a little bit skeptical. I think that he probably just rushed through the procedure. Since I'm just a regular person, not a very important type of person, I think he probably just rushed through the procedure, went through the motions, and went on to the next patients like he normally did. So in that respect, I'm a little bit taken aback by Dr. Kriteman and his bedside manner. Now, would I recommend Dr. Kriteman? Probably not. If I had to do this all over again, I would look for another physician who was experienced with aquablation and probably choose him. Now, I doubt that Dr. Kriteman will ever view this video, and I doubt whether he'll ever take the time to watch it all the way through or not. But if he does, it's my hope that he will take a few minutes for self-reflection and reflect back on himself and whether or not he treats all of his patients equally, and whether or not he's a rushed physician, or whether or not he actually takes the time to treat each patient individually and make sure that he gives them his best efforts or not. Once he does that self-reflection, I hope he reaches out to me, and I hope that we can sit down maybe in his office and have a conversation about my feelings and the way that I think that I was treated by Dr. Kriteman, and whether or not he is that type of physician, who's just rushing on to the next patient, trying to make as much money and get as many billable hours as possible. There's a saying that I read not too long ago. It says that reputation is only what other people think about you. And I have no doubt that Dr. Kriteman has a very excellent reputation, and a lot of people think very highly of him. I know I did too, based on the research I'd done and listening to his webinars. But my opinion of Dr. Kriteman is maybe not the same based on my experience with Dr. Kriteman. So reputation is just what other people think about you. But character is what you are. And I don't want to call Dr. Kriteman's character into question, because that's not my place. But only he can decide that for himself, and only he can reflect back on the fact whether he treats all of his patients equally, whether he treats all of his patients with kindness and care, whether he takes the time to make sure that every one of his patients is treated the same, and that he did go back in there. He did take the time to look at the fluffy tissue. He did try his best to remove that tissue, and that he did try to cauterize the bleeders, and he didn't give me kind of what you might call a rush job, or rush me through the procedure so he could get on to the next patient, because I know we had a bunch lined up for just that day alone. So I guess, everybody reaches this sort of complacency once they've done something over and over again. In the beginning, they probably take a lot more time and care. So maybe the fact that I picked such an experienced physician may have worked against me in the long run because of that complacency that may have set in. But that's just my thoughts, and that's just my opinions of Dr. Kriteman. So you need to do your own due diligence and make your own informed decisions if you're thinking about doing the aquablation procedure. You want to pick a doctor who's going to give you the time and the care, and talk through things with you, and be willing to empathize with you, especially when he saw all that tissue. I mean, when I told him about that crisis that happened, when I had to pull the catheter out, he didn't even commiserate with me. I mean, no empathy again whatsoever. He didn't say, "I'm sorry that this happened." He just kind of sloughed it all off and just, heard me out of the room. So, this is part 3. At the time of this filming, I'm now about 3 weeks out from the procedure, about a week or so out from that appointment, that post-op appointment with Dr. Kriteman. Still bleeding, still feeling a little bit of burning sensation, especially at the end of the stream. I'm hoping that the burning will stop soon. I am happy about the fact that my stream starts really quickly. My stream is pretty strong. My bladder does seem to be emptying out okay. It's just right now the bleeding that's bothering the most. Still never felt any pain or discomfort from the procedure. Never had to take any medications whatsoever. It's for pain, only the antibiotics. So I will probably do one more video in part 4. I want to talk to you about the expenses and the bills that are coming in based on the aquablation procedure, what I'm having to pay out of pocket, what the hospitals and doctors' offices are charging for the procedure, what my insurance company is paying towards the procedure, and also a follow-up for how long I bled and whether or not the bleeding finally stopped. So again, thank you for listening to part 3 of my aquablation story. And I look forward to seeing you hopefully in the final chapter, part 4. So take care, have a good day, and if you're thinking about doing aquablation, again, do your research, and I wish you the best of luck. So until part 4, take care, have a good day, and thanks for listening.